So the other care plan we spoke about was mobility and movement. So with this one, we need to talk about the communication care plan. So how do you support individual with specific communication need? So how do you know the need of a resident? You have to check the care plan. The care plan will tell you what their communication need is. So I'll read this care plan. So it says to be okay. So I read, how is the person able to communicate? If the person is unable to communicate verbally, then you must include what forms of communication are able to be used, such as facial expression, body language, and any specific forms of communication the individual has. Say for instance, rubbing of their leg when feeling anxiety. So with communication, with specific communication need, you need to read the care plan. The care plan is your manual that you will use to communicate very well, the right way. So I read, if the person is experiencing dementia or difficulty in communication, how would staff recognize the person's need? Are there cognitive ability? Do they have cognitive ability? And the person, are they able to understand what is being communicated? So there's always a risk assessment done to ensure the capacity of every resident with regards to communication. So some residents, they are not able to communicate verbally. So some residents, due to language barrier, they will need an interpreter. So some require speech therapists. So some people, are they able to see? Because it is what you're able to see that you're able to communicate. Do they need glasses? So this kind of questions, who is the optician? So this kind of questions helps with communicating. So I'll just quickly read from the care plan, So this resident can speak and make herself understood, although she does not tend to start a conversation. Due to this resident experiencing dementia, some of her words can be muddled